This is Dr. Sandeep Madaan, Anatomy faculty at DAMS, and today we are going to discuss the INICET May 2022 anatomy questions. This time anatomy particularly was on the easier side, and most of the questions were directly from the notes. So all these questions that we are going to discuss are purely on the recalled basis, and so you might feel that one or two choices are maybe here and there, but this is as close to the question paper as recalled by the students, right? So let us start with the questions. This is the first question: structures arranged from anterior to posterior relation at the lung hilum are. So basically this question is related to the lung hilum or the root of the lung, where the pleura gives an extension over the structures which are present at the hilum of the lung. And in this relationship, let us look at the anatomy here. When you look at the right and the left lung hilum, where we have the root of the lung, that is the pleural extension, okay, over these structures. So there we can see anterior to posterior in both the sides, right and left lung. The relations can be remembered by mnemonic verb, that is pulmonary vein, pulmonary artery and bronchus. Okay, so here you can see these are the pulmonary veins. These are pulmonary veins on both sides. These are anterior. Then you have pulmonary artery, and then you have bronchus. So that is anterior to posterior relation. But it is also surprising to note here on the left side, you will observe at this part you have a single bronchus here, okay, which is called as the main bronchus of the left side, or left principal bronchus. So one bronchus but two bronchial artery. But on the right side, two bronchi are visible but only one bronchial artery. So that is also one of the very important part here. And so that is why answer to this question will be C, pulmonary vein, artery and bronchus, because the relations were asked from anterior to posterior. Now that we have understood this, let us move on to the next question. Which of the following is not a branch of facial artery? Superior labial, mental, inferior labial, lateral nasal. And let us first discuss the anatomy of the facial artery, and then we will come back to the question again. Here what you can see that this is the facial artery which is present on the face part. First let me describe the face part of the facial artery. There you can see it is well approaching this part here. The lower lip comes, so it supplies the lower lip and it supplies the upper lip. So lips are called as labia. So superior labial artery and inferior labial artery. Then it approaches the lateral aspect of the nose. There it gives the lateral nasal artery. And then it will continue as the angular artery. And as we all know, it is the angular vein that continues as the facial vein, because the facial artery continues as the angular artery, okay, because it approaches the angle of the eye. And it is important to note that this facial artery continuation in the form of angular artery, it is going to anastomose with the dorsal nasal branch. This dorsal nasal branch is a branch of ophthalmic artery, that is further a branch of internal carotid artery, okay, whereas the facial artery is a branch of external carotid artery. So that we can say at the angle of the eye, we have one of the site where internal carotid artery branch means it is coming from the internal carotid artery distribution, right? It is going to anastomose with the external carotid artery branch, right? So here these branches, they are the branches on the face. But looking at the facial artery, it is not giving branches only on the facial part. It does have the cervical part as well. So let me now describe the whole course of the facial artery, okay? So here what you can see that the facial artery, it takes origin from the external carotid artery. It's an anterior branch of external carotid artery. Look at this. This is the common carotid artery. This one is the external carotid artery. This one is the internal carotid artery. From the external carotid artery, three anterior branches are going on. Like you can say this is the superior thyroid, this one is the lingual, and this one is the facial artery. Okay, looking at the facial artery, this facial artery, it makes an S-shaped loop. Let me describe that X-shaped loop. So basically the branch here, you can say this is the external carotid artery. This external carotid artery is giving the facial artery. This facial artery, it will be making a loop here around this structure. This is mandible, this is mandible, and this is a gland here. So what is the name of the gland? Submandibular gland. Submandibular gland. Okay, so the facial artery will be making an S-shaped loop like this. So it is having one convexity and another convexity, one around the gland, the other around the mandible. And this part is the cervical part because it is given in the cervical region. After that, this part is the facial part. In the facial part, we have already learned the branches. That was like very easy to remember: inferior labial, superior labial, lateral nasal, and the angle of the eye, angular artery. Angular artery, it anastomoses with the dorsal nasal branch of the ophthalmic artery. But what about the cervical part? The cervical part is going to give these branches. The cervical part, it will give certain branches which can be remembered by the mnemonic STAG. What is STAG? S is submental artery, T is tonsillar branch, A is ascending palatine artery, and G is glandular artery because it is going to supply the submandibular gland. Because it is going to supply the submandibular gland. It is passing over that gland and thereby it will be giving one branch also. So STAG, these are the branches from the cervical part, and the facial artery on the face will give these branches that we have learned. So now we are done with all the branches of the facial artery. We have seen the course of the facial artery also. Let us now come to the question that was asked. So here, just before coming to the question, let me describe one choice was there as mental artery. Now let me describe what is this mental artery branch of. We can see here, this is the external carotid artery which is dividing into maxillary artery and the superficial temporal artery. These are the terminal branches. Okay, from the maxillary artery various branches are given, and one of the branch is, like you can see, inferior alveolar artery. This inferior alveolar artery will take care of the lower jaw teeth. Also, it's one of the, you can say, branch here is like mental artery, which will come out of the mental foramen. So the mental artery is a branch of inferior alveolar artery. Inferior alveolar artery itself is a branch of the maxillary artery. Is that fine? So this is the distribution. Now we are done with this part and we are in position to come to the question. So this was the question: which of the following is not a branch of the facial artery? There we can say superior labial is a branch, inferior labial is a branch, lateral nasal is a branch. So mental is definitely the answer, right? Now let us move on to the next question. Superior gluteal nerve supplies all except. This is very important topic. Almost all the exams you get a question on certain topics of anatomy, right? Foramen of skull, this particular part, epiploic foramen, palm muscles, their nerve supply and where they are absent and all. Those are certain areas from where the questions are asked, along with pharyngeal arches, along with the neural crest cells, right, and the cerebellum, right? Now let us discuss this part, superior gluteal nerve. Superior gluteal nerve supplies all except. So I will describe the anatomy, but I will give you the list, the muscles which are supplied by the superior gluteal nerve, which can be easily remembered by the mnemonic tense middle men. Tense middle men is the mnemonic, and the name of the muscles are tensor fascia lata, gluteus medius, and gluteus minimus. Okay, And here you can see answer will be pretty obvious. Piriformis is not supplied. Let me describe the anatomy of the superior gluteal nerve. Okay, see this. When you take this cut section here, you have cut the gluteus maximus muscle. You have cut this gluteus maximus muscle. You have gone deeper to it. This is gluteus medius. You have cut the gluteus medius in these two parts. You can see the gluteus minimus. So maximus, medius, and minimus. Now, first thing that we can appreciate in the diagram, that although all these muscles are the gluteal muscles, but they are not exactly, every muscle is not exactly posterior. See, gluteus maximus is coming from the gluteal region, but it is attached also posterior on the femur. Gluteus medius is attached lateral aspect of the femur, and the gluteus minimus, it approaches almost anterior part of the greater trochanter. Okay, so the orientation is from posterior to lateral to anterior. In this aspect we can understand, because the final resultant pull of the gluteus maximus will be from behind, so it will be doing the chief extensor action. Also, if at all you consider the rotation, it can do the lateral rotation. But looking at the gluteus medius and minimus, those muscles are pulling from front, because the final resultant pull is from front, so they are doing the medial rotation. Please remember. So these three muscles that I have written a mnemonic as tense middlemen, they have two things in common. One is their nerve supply, second is their action. So what is their nerve supply? Nerve supply is, you can see this is the gluteus medius, minimus, and the tensor fasciae lata. They all are supplied by superior gluteal nerve. And you can see this muscle, this is the piriformis muscle. The nerve coming above the piriformis is the superior gluteal nerve, which is going to supply these muscles. And the nerve coming below the piriformis is this inferior gluteal nerve, which is going to supply gluteus maximus. And this huge nerve is the sciatic nerve, okay, which is passing above these muscles. These muscles together, they are called as a sciatic bed structures, over which the sciatic nerve will pass. Okay, what are the name of these muscles? You can see the obturator internus, above is the superior gemellus, below is the inferior gemellus, and this quadrangular muscle here in the femoral region, this is quadratus femoris. Okay, so that is what about the anatomy part here. And also let me describe that along with their action, this gluteus medius and minimus, they maintain the pelvic position. So suppose this is pelvis and this is gluteus medius, mainly gluteus medius and also gluteus minimus, you can say. This is the feet on the ground, this is the feet on the ground. Now suppose this feet is taken off of the ground like this, this feet has taken off of the ground, so there is no support here. If there is no support, there should be tilting, but that tilting is prevented by the action of this muscle. This muscle, the supported side muscle, will contract. Because of the contraction, it will prevent the tilt in the unsupported side. Okay, that is the meaning. But if at all you see, if at all this muscle is not working, there will be tilt seen. If this muscle is not working, there will be tilt seen like this. You can see in this part, this muscle was not working, so the tilt was seen. This is called as Trendelenburg sign. This is called as Trendelenburg sign, and this is very frequently asked area, Trendelenburg sign. In this part, the gaits are also important. If it is a unilateral gait, it is lurching, but if it is a bilateral gait, it is waddling. Okay, so this is all about this anatomy. And now we have already discussed, the answer was piriformis, right? So I hope this every part is clear up to this. Let us move on to the next question. Is a young patient with absent thymus and presented with hypoparathyroidism and tetany. Which of the following marked area in the picture is defective in this condition? This question is a direct repeat from the notes, and if you see, we have discussed this part in the classes. And what is this condition where the thymus is absent and hypoparathyroidism is seen? It's a DiGeorge syndrome, right? It's a DiGeorge syndrome. And here what you can see, this is the first cleft that makes the external auditory meatus. In fact, the Langman 14th edition has given the update that it is not the first cleft that will be making the external auditory meatus, it is rather the first arch which is going to make the external auditory meatus. But anyway, in the picture we can understand this is the first cleft, this is the tympanic cavity made by the first pouch, and this is the auditory tube again made by the first pouch. And this is what is the site of second endodermal pouch, second pharyngeal pouch, which is going to make the tonsil. This is the third pouch which is going to make the thymus along with inferior parathyroid. So if this A is affected here, so the thymus will be absent and one part of parathyroid will be absent, so it is hypoparathyroidism. Okay, what about this part here? This is the, it is going to make the ultimobranchial body and superior parathyroid. Ultimobranchial body is the one which is responsible for parafollicular C cells. So this question is quite straightforward question. Answer will be the defect at the A that will lead to the this given features of the patient. Okay. Next question. Damage to the structure producing the elevation mark lead to the paralysis of which of the following muscles? Now if we look at this part here, this is what, this is the rhomboid fossa or the floor of fourth ventricle, right? Here you can see these are two superior colliculi, these are two inferior colliculi. That means this is a dorsal aspect of the midbrain. Okay, this is superior cerebellar peduncle, this is middle cerebellar peduncle, and this one is the inferior cerebellar peduncle. Overall this becomes the rhomboid fossa. This is the floor of fourth ventricle, this is the median sulcus. Now if you roughly divide this part into two areas, this is the pontine part above and the medullary part below. Okay, in the pontine part above you can see these two elevations are there. These two elevations in the dorsal aspect of the bones, right? Pretty obvious, everyone knows this is facial colliculus. Now the question is, what is facial colliculus? As we understand that in the like you can say this is the dorsal aspect of the bones part. Here what you can see here is this sixth nerve. Okay, from the sixth nerve nucleus, the sixth nerve is coming out, and now here we can understand that this is the seventh nerve nucleus. The seventh nerve will first go wind around the sixth nerve nucleus and then comes on the ventral aspect. Thereby it creates an elevation here. This elevation on both the side, the dorsal aspect of the bones, is facial colliculus. Okay, now look at the language of the question. Here the language is important. If the question is like damage to the structure producing the elevation, now who is producing the elevation? It is the winding around the seventh nerve fibers which are winding around the sixth nerve nucleus. They are producing the elevation. So damage to the structure producing the elevation marked, it will definitely, it is talking about the seventh nerve, so the answer will be B, the soreus. But if we change the language of the question, if we say damage to the nucleus lying deep to the elevation mark, then answer will be sixth nerve nucleus, and then lateral rectus will be the answer. So the language is important here. First part is to identify. Obviously we can identify here, we know the anatomy, but also language, if you change, answer will also change, right? So very, very important. Please be careful about it. Next question, which is formed by three bones. Now here answer is foramen lacerum. Why foramen lacerum? Let us look at the anatomy. Here you can see this is the foramen lacerum, which is actually formed between, this is the part of the occipital bone, okay, basilar part, this is the petrous part of temporal bone, this is actually the greater wing of sphenoid. So between sphenoid, temporal and occipital, these three bones are there. Between these three bones we have this foramen which is called as foramen lacerum. Okay, and that is why answer to this question is foramen lacerum. But if you look at the other foramen there, we can see this is the foramen magnum, which is one of the choice here. The foramen magnum is present only within one bone, that's the part of occipital bone. Between the occipital and the temporal we can see the jugular foramen and the rotundum, ovale, spinosum. These all are the parts of the sphenoid, only sphenoid bone, that particularly greater wing. And between the lesser wing above and the greater wing below, this is the superior orbital fissure. So this foramen of skull again is very, very important. Almost all the exams you will get one question on the either foramen or the structure passing through. In this particular exam you had two questions. One was this foramen lacerum, so and another was this. Which of the following structure passes via jugular foramen, has separate canal, right? So actually we know that 12th nerve is ruled out because it will not pass through the jugular foramen at all. So passing through the jugular foramen, we have 9th, 10th and 11th nerve. Now which one has a separate canal? Means when they pass through the jugular foramen, they have actually dural sheath around them. Let me tell you, they have dural sheath around them. Let me show you first this. This is the jugular foramen through which we can see, along with the you can say the jugular vein that is along the posterior part of the jugular foramen, the sigmoidal sinus will exit, but that will continue as the jugular vein. And anterior aspect we have inferior petrosal sinus, which is not shown in the diagram, but then from the middle part you have the 9th, 10th and 11th nerve passing through. So 9th nerve is there, 10th nerve is there, and the cranial accessory nerve is there. Okay, cranial accessory nerve is there. 9th, 10th and cranial accessory nerve, these are the branches are there. Okay, now that you have understood this part, you can see that this diagram will make it obvious. Although these three nerves are passing through the jugular foramen, but look at this, 9th nerve is passing through a one sheath, it is having one sheath of the dura around it, and this dural sheath around 10th and 11th is common. So these two are having a common sheath, whereas 9th has a separate sheath. Okay, so answer to this question will be 9th nerve. Answer to this question will be 9th nerve. Okay, so next question, which of the following structure is merocrine gland? A, B, C, D, and this is the slide given. Okay, now we have to identify first what are these structures, and then we can say which one is merocrine gland here. So first of all, A is the hair follicle, so that is not a gland, it's a hair follicle only. Okay, and this is the shaft part there, hair follicle, so this is hair follicle, hair shaft, right? And here you can see this is the gland, this is sebaceous gland. Sebaceous gland is an example of holocrine gland, but these are the sweat gland. These sweat glands are the example of, examples of what? That is the acrine type of gland or the merocrine gland. So answer will be C. Okay, C is the merocrine gland here. That let me show you this little bit anatomy here. Whenever you get a slide where the hair follicle, hair shaft is given, here you can see this is a gland slide of the skin with the glands. Sebaceous gland will look like grape-like cluster, and it will be very closer to the skin surface. Also it will be very close to the shaft part, and this coiling is one of the feature. Also it is away from the surface is the sweat gland. But sweat glands are of two types, it is hypocrine type or the acrine type. So the acrine type is the one which opens on the skin surface, okay, and it is also having the coiling. Hypocrine is the one which does not open on the skin surface, rather it opens on the hair shaft. And here what you can see in this particular diagram, this is the labeling. This is the hair follicle, this is the sebaceous gland, holocrine example, this is the sweat gland, which is acrine example. So sweat, among these when you have to select, obviously you will mark which is the merocrine. So the sweat gland will be the answer here, right? Next question, blood supply of the Marsh structure. Now in this given section, the Marsh structure is the splenium of the corpus callosum. We can see the corpus callosum here, right? This is the rostrum part, the genu part, the body part and the splenium part. Now splenium part has been marked here, and the question is talking about what is the blood supply. Answer to this question is ACA and PCA, because the splenium part is supplied by the pericallosal arteries like anterior and posterior. Anterior, it belongs to ACA, it is a branch of ACA, anterior cerebral artery, and the posterior pericallosal artery is a branch of PCA, that is posterior cerebral artery. And if we look at this way, in fact we know that these anterior, middle and posterior cerebral artery, they are dominant on one surface, although all of them are supplying in all the surfaces. So if you look at this way, the anterolateral aspect is mainly, major branch here is the MCA, whereas ACA and PCA are also there. But look at the medial surface where the corpus callosum is present. It is majorly the ACA, but in the splenium part here we also have this territory of the PCA, and the inferior part we have the PCA as the dominant artery. Now let me show you particularly this medial surface where we can see the ACA and PCA part here. You can see this is the splenium and it is supplied by this pericallosal artery which belongs to anterior cerebral artery, and this is the posterior cerebral artery which is also giving branches to the corpus callosum. So obvious answer to this question is anterior cerebral artery and posterior cerebral artery, ACA and PCA are the supply. Okay, now moving on to the next question. Which is the origin of the marked structure? Now first of all let us look at the structure. What is the marked structure? What is the section? This is the section, and here you can see the corpus callosum, this is the septum pellucidum, and this is the fornix. So the marked structure is the fornix. Fine, but let us first look at the other nuclei. This is caudate and this is the thalamic region here. These two are the lateral ventricle and this is the third ventricle here. Okay, and here you can see that this is the insula part, this is the insula. And now let us see if this is the fornix which is marked here. Fine, fornix, what will be the origin? Right answer will be hippocampus. Let us look at the anatomy and their connection. This is the hippocampus from where the fornix begins on the left and the right side both. So we have this is the body of the fornix where these two parts left and right side they are merging together. Then they also these columns they will separate, right? These columns will separate and they will go to the both side mammillary body. They will be approaching the mammillary body. So basically they are coming from the hippocampus going to the mammillary body. Okay, and this mammillothalamic tract will further connect mammillary body to the thalamus part, anterior nucleus of the thalamus part. Okay, so basically these connections they are a part of a circuit. Which circuit? Let us look. They are the part of Pepe circuit. Here you can see this is the hippocampal formation through which the efferent is going as the fornix reaching to the mammillary body. From mammillary body the tract is the mammillothalamic tract which will be reaching the anterior nucleus of the thalamus, then to the cingulate gyrus and then to the entorhinal cortex which will send to the hippocampal formation. This becomes a circuit which is a part of Pepe circuit. Okay, which is a part of Pepe circuit. So obviously when the fornix has been marked in the question and it is asking from where these fibers are originating, answer will be hippocampus. Okay, so let us move on to the next question. Answer to this question was hippocampus. What is the nerve supply of the marked muscle? Now if we look at this muscle, these are small worm like muscles seen. So these four are the lumbricals. Here the second lumbrical has been marked. So the lumbricals first and second are supplied by median nerve. Third and fourth, if these were marked structure, then this will be ulnar nerve. Third and fourth are supplied by the ulnar nerve. First and second by the median nerve. This is the thinner part, this is the hypothinner part. Okay, where we have the abductor on both sides, abductor of pollicis and abductor of digiti minimi. Inside we have the flexor. Okay, but if you go one level deep you will be getting the you will be getting the opponents of both sides. Okay, and these are the flexor pollicis profundus tendon. You can see the cut part of the flexor digitorum superficialis, and you can see the flexor digitorum profundus tendon going from this flexor digitorum profundus tendon. These lumbricals are taking origin. Okay, so obvious answer to this question will be median nerve because it is the second lumbrical which has been marked. Okay, so now this is what we have already discussed. You can see this labeling, and remember this very important. If you do not sacrifice for what you want becomes the sacrifice. अगर आप आपकी चाहत के लिए बलिदान नहीं करेंगे तो आपकी चाहत ही बलिदान हो जाएगी. So my dear students, keep on working hard. God bless you all. This is my contact detail. If you have any doubt, please feel free to contact me. Best wishes. Thank you. Bye bye.